Frontline hospital workers have been going non-stop since the start of the coronavirus outbreak. A year into the pandemic, administrators, doctors, and nurses are having to manage clusters within facilities, the recent spike in holiday cases, and now the mass rollout of vaccinations. We'll be talking with the top administrators of Hawaii's hospitals to see what's working and what's not in COVID-19 Hospital Checkup. Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Yanji Denise. Hospitals in COVID-19 hotspots on the mainland are on the brink of collapse, overwhelmed with patients. Fortunately, we are not at that breaking point here, and that's critical because of our already limited capacity. Hospital doctors, nurses, and staff have been working tirelessly to keep their patients and facilities safe. Now they're helping to run mass vaccination sites. Our panel tonight are administrators representing various hospitals across the state. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and on the PBS Hawaii Facebook page. Now to our guests, who are all appearing via the internet. Dr. Rick Bruno is the president of the Queens Medical Group and the Queens Health System's Senior Vice President of Patient Care. He's an emergency room physician who continues to work in the ER department. Martha Smith is the Executive Vice President of Oahu Operations at Hawaii Pacific Health. She's worked in hospital operations and healthcare in Hawaii and Florida for 25 years. Sam Belukov is the hospital administrator at Kaiser Permanente Hawaii's Moanalua Medical Center. He oversees the operational, clinical, and financial activities of the 295-bed hospital. And Ryan Ashlock is the operations executive for Adventist Health Castle. Prior to his move to Windward, Oahu, he was the finance executive at Adventist Health Feather River in California. Linda Rosen, head of the Hawaii Health Systems Corporation, which includes Hilo Medical Center, Kona Community Hospital, and other facilities, initially accepted an invitation to join us tonight, but later canceled her appearance. Thank you all for being here. I want to start with what is on everyone's mind right now, and that, of course, is the vaccine. Martha, let's start with you. You were your facility was the first to open one of the so-called pods down at Pier 2. Tell us how that's going so far.
It's going extremely well. The appointment system initially, I think, was difficult for some people, but we refine it every single day. One of the things we've learned with COVID-19 is you have to be ready to innovate and implement on a daily basis, sometimes an hourly basis. So it's going extremely well. We've administered about 15,000 vaccines so far, and we have about another 12,000 appointments. And we will administer those vaccines as quickly as we can get the vaccine into our hands. And so we've been very pleased. I know we've had a lot of great compliments on how it's running. And I think our team's just done a fantastic job in getting it up and running quickly and making sure we're getting those shots in the arms.
Dr. Bruno, I know that Queens opened their facility up at the Blaisdell on Monday. How is that going?
I think our experience is similar to what Martha just outlined. Our goal is to vaccinate up to 6,000 patients a day. We did 1,200 the first day. We've done about 12,000 so far. 12,000, we're doing about 1,200 a day. So far, so good. The experience I've heard from people has been good. But like anything, like Martha said, is we started this from scratch and we'll learn as we go.
Let's talk about Kaiser Permanente and Adventist Castle Health. They're administering vaccines as well at their facilities. Mr. Belukov, can you tell us how it's going where you are?
Yeah, absolutely. It's exciting. We've had a variety of opportunities and experiences. We've really tried to expand our outreach and try different things. So we've tried everything from walk-in clinics at the hospital. We've had a mass vaccination opportunity. We've started deploying the vaccines at all of our larger clinic locations. So we're doing everything from smaller shot centers to mass vaccination, and it's been a really exciting endeavor. We're close to 20,000 total vaccines. And walking through those lines and seeing the smiles on people's face, seeing the hope in their eyes has been phenomenal.
And Mr. Ashlock, how is it going at Castle?
Yeah, similar to what the others have said, here at Castle, it's been going really, really well. We've been able to administer over 8,500 vaccinations here on the Windward side so far. And to tag on to what Sam has said, one of the amazing things that we have seen in this vaccination process is reunions for some people as they have come back, especially the over 75 group. Just some amazing stories of individuals being able to see each other, the hope that they have to be able to return back to some sort of normalcy in their lives.
You know, the administration on a national level has said that they want to get to, I believe, 100 million vaccines in the first 100 days. Let's talk about the vaccine distribution from the federal level. Hawaii's not getting what we initially thought we were getting. How is that trickling down to the hospital level in terms of being able to give patients what they want? Martha, let's start with you.
Well, so far we've been able to schedule as many as we can for Kauai. And Kauai's actually doing quite well. Wilcox Hospital is working together with the other facilities and caregivers on Kauai to get the vaccines into arms. And so far they've done about 2,900, I know, at our Wilcox Hospital. They're doing about 300 more a day. And they feel pretty good about where they're at. But again, the more vaccine we can get delivered, the more we can get out to the patients and the families and the caregivers and the essential workers in the community.
Dr. Bruno, I know that initially some people who had accompanied people who were in their 70s and over 75, the caregivers were getting the vaccines as well. Now that's come to a stop. How much more vaccine can do you need to reach the levels that we need to reach the goals that the administration has set out?
I think we need as much vaccine as we can get. As Martha said, his goal is to get as many vaccine in people's arms as we can. I looked on the Department of Health website, who posted every day. I think there's 200,000 allocated for Hawaii right now. And we're working very closely with the Department of Health, the other hospitals, to ensure that we get enough vaccine, and the vaccine we have, we get as rapidly into people as fast as possible.
Mr. Belukov, the Lieutenant Governor has set out a goal. He said that by July 4th, everyone who wants a vaccine in Hawaii should likely be able to have gotten one. Do you think that that's realistic?
I do. It's totally dependent on vaccine supply, though, right? This is something that we've talked a lot about, the folks here in this room. We come together multiple times per week to talk about what our efforts are. And I know that I speak for all of us when I say that our teams are locked and loaded. We've got nurses, we've got doctors, we've got medical assistants, we've got people who are just waiting to receive more vaccine supply so that, to what Dr. Bruno said, as soon as we receive it, we can put it into arms. I know that Kaiser, we've put together a plan to be able to vaccinate almost 400,000 people in just a matter of 3 or 4 months. We've got the people to be able to do that. We've got the locations ready to go. And if the supply opens up, we'd be able to pull that trigger. I want to make a quick comment about the state, though. They have done just a yeoman's work trying to get this out as quickly as possible. The Department of Health, the Healthcare Association of Hawaii, they have just done a tremendous job getting the vaccine out to the hospitals as quickly as possible so that we can get it into those syringes and into arms.
Mr. Ashlock, can you actually tell us a little bit about how that works from the Department of Health? I know that the state finds out usually on Thursday what they're going to get for the following week. And then on the hospital level, what do you find out in terms of when how many doses you're going to get?
Yeah, I'll use this week as a perfect example. All of us here on this didn't receive information on when we were actually going to get vaccine until late this afternoon in terms of what the numbers were going to be for this following week. And that it creates a challenge in order to be able to plan accordingly, to be able to opening up appointments for our community when you just don't know what you're going to get. And so that does lead to frustration in the community when, they've registered to be able to get a vaccine, but yet there's not appointment slots. And we have to be very careful about opening things up because you don't want to have to end up canceling people as a result of the fact that there isn't enough vaccine available. For Castle specifically, because of the vaccine shortages that Hawaii has experienced over the last couple of weeks, we haven't been able to administer nearly as many first dose appointments as we would like to, because we've had to take the supply that we are getting to administer for second doses from the people that we had done 3 weeks ago.
You know,
I'd like to give a
sorry, go
shout
ahead,
out,
please. Yeah.
sorry, to
No,
the
please go ahead.
Healthcare Association of Hawaii. Hilton Rathel has just, he's been terrific. And we all talk as hospitals statewide. We talk 3 times a week. We talk about what vaccine we need, if we need to share, if other organizations are running short, can we help one another out? And you know, I think as a whole group, we're just doing our best to make sure that everybody has what they need when the supplies do come in.
You know, Ryan, I want to follow up on something that you said about saving that second dose. There have been some, some other people, let's say on the mainland, and as this goes on, as this conversation continues, who say, let's just give everybody a first dose. Let's just get as many out there as possible. What's your view on that?
Yeah, I can understand that perspective. I think the challenge is there's things that change naturally in terms of the recommendations constantly. You know, we have seen that it needed to be within, if it's a Pfizer vaccine, it needs to be within that 21-day window. If it's the Moderna, it needs to be 28 days, I believe. And now we've seen some information that's come out that says it, in certain circumstances, it can be as long as 6 weeks. So I think, from our perspective, we're just continuing to be able to go with that 3-week recommendation as that seems to be the consensus at that point. And it is important to make sure you get that full immunity to that 95% as well. And you don't want to put that at risk. So I think continuing to go to the 3 to 4 week time frame, depending on the type of vaccine, is an important thing to follow.
We have some questions coming in from the audience, and we do welcome you to call or tweet or email us your question. Dr. Bruno, I want to ask you this since you are a medical doctor. What does the vaccine actually do? Does the vaccine contain any type of steroid? Can you talk about what's actually happening to your body once you get the shot?
Sure. I think one of the things we will look back at this vaccine development and the vaccine itself and the speed which it came to market and the science behind it is absolutely fascinating. And so there is no steroid in the vaccine. The vaccine is RNA. It's synthetic RNA that your body then generates a protein that is part of the virus and then reacts to it. It's the first time we've ever used a vaccine like this. And again, the science is absolutely fascinating. And as far as we can tell, is very efficacious, in the 90 percentile for the vaccine. So it's really wonderful science.
Martha, you mentioned Kauai. I wanted to ask, this is and I'll open this up to the broader panel as well, but let's start with you. CJ on Maui says, what's the main reason vaccinations are delayed in Maui County? How is distribution going for the neighbor islands, and how do we make sure that those in our more rural communities have equal access?
Well, I can tell you with the Healthcare Association, as we talk as a group, we try to portion it out based on, the population size and making sure everybody gets their fair share. Let's say 10 trays come in, and then they portion it out based on population size. I know some things, there's been some difficulties with coordinating on, neighbor islands, even on Oahu, in terms of, who gets what, when. But we really have tried to make it as equitable as possible as we work together and with the Department of Health to make sure that the vaccine is getting distributed appropriately.
Sam, I see you nodding there.
Yeah, no, it's a very valid question, and there's all sorts of complications with how this has been going out. But again, to Martha's point, the thing that's been nice is how these different organizations have come together to provide opportunities for folks. So going to the Big Island, right? We've been partnering with those community hospitals as well as our clinics to get Moderna vaccines in particular, because their storage requirements are significantly less strenuous than the Pfizer vaccine. So as those Moderna doses have opened up, we've been having those sent to Big Island, to Kauai, to Maui, in order to be able to give to folks there. But I know on Big Island, the 2 hospitals on each side have just done tremendous at opening things up for the whole community. And I know that we're going to start to open up vaccine clinics in our 2 clinics on the different sides in Hilo and Ancona to do at least 50 a day. Same thing with Maui, partnering with Maui Health System. We're looking at opening up both mass vaccination centers. We're looking at dedicating our Kihei clinic to be a vaccination site. I know that MHS is ecstatic about the chance to start getting thousands of people lined up for vaccines.
Yeah, I mean, the thing about some of these neighbor island sites, obviously, is you have people that are having to travel long distances. Do you envision a time where there could be, I know there are limitations in terms of the storage, but do we envision a time where there could be, mobile clinics, if you will? Is there a way to actually bring this closer to the communities where they are needed? Sam, what's your take on that?
Sure, yeah, certainly. I think that, if you take a step back and think about the beginning of this pandemic, a year ago, we were talking about 12 to 18 months before a vaccine would be ready. And here we are in January, and there's already tens of thousands of people across all islands that are already receiving their vaccines, right? Our kupuna have already started lining up. Our essential workers are starting to line up. And it is slower than we would like, but this is really early in the process. And there's a plethora of additional vaccine candidates that are still going through the process. Some from Johnson & Johnson, AstraZeneca. There are oral vaccines that are going through their clinical trials. So as these vaccines continue to develop and as the data comes back showing that they are safe and effective, they'll come to market. And every additional vaccine that comes to market is going to expand exponentially the access from pharmacies, from retail pharmacies to private doctor's office clinics, to your point, to mobile vaccination centers. Right now, again, we're in a very fortunate spot to be vaccinating as early in the process as we are, and it's just going to get better from here.
Mr. Ashlock, I want to ask you, Kamahoe wrote in a question on Facebook asking about the doses that might not be assigned and that might be expiring toward the end of the day. How do we make sure that those aren't wasted? We've heard about situations on the mainland where hundreds of doses are just thrown out because they've expired and they just don't have the people there ready to go. How do we ensure that that's not happening here in Hawaii?
Yeah, so we make sure we're mixing the appropriate amount of vaccine every single day based off the appointments we have. And that's part of the reason why all of our organizations are taking appointments versus walk-ins, to make sure that you're planning appropriately for the number of people that you're going to be seeing. Now, of course, there are situations where there are no-shows. And so as a result, we are keeping a standby list of individuals that you will call late in the day of your vaccine clinic to be able to say, we have 5 doses left over. And then you start to have your team start calling individuals to be sure that the vaccine does not go to waste. And the reality is that pretty much happens every single day as you go through this, because you can't plan perfectly for it. But the great news is, at least from our organization, we haven't had to waste anything, because we've been able to get a hold of people to be able to come in really at the last minute to come and get their vaccine.
Yeah, if I can tag on to Ryan real quick. So this is, I think, a pretty unique situation here in our state, where our healthcare organizations are working truly like a community. So Martha mentioned these 3 times per week that we come together. We talk about these kind of things and we share these kind of practices together. And so we're able to learn from each other, which helps our community at large. Ryan's comment about not wasting any, we haven't wasted a single dose either. And that's because we do the exact same practice with a standby list. And we have kind of a last call where if there's 2 doses left in a vial, we're not going to waste those. There are people who are ready to receive those. And so I think that our community is actually being very favorably positioned because of some of this coordination between the different facilities. It's been a wonderful experience to be able to partner with these organizations like Castle, Queens, and HPH.
Michael has a question. Michael on Maui has a question about how many people actually need to get the vaccine for it to be effective in our community, and kind of guessing around that number. He wants to know, why do we have to guess? If the population is 1 million people, let's say, I'm not counting, I'm assuming children here, won't 1 million people need it? Martha, what is that threshold? What's the magic number for Hawaii? How many people need to get this vaccine for it to protect our community?
Well, our view is everyone needs to get the vaccine to protect the community. This is very important, and people talk about herd immunity. I know that, and saying, oh, there's a critical mass, and then you don't need to worry about it. But our view is we would like everyone to get the vaccine. It's safe, it's great science, and it will keep us all safe.
And Dr. Bruno, I saw you nodding there as well. What's your take on that? Is there a magic number? I know we're trying to get to everyone, but at what level do we actually feel like, okay, we're in a good place?
And just to reiterate what you said, clearly want everybody to get the vaccine because the virus is killing people. But herd immunity, the estimates are somewhere 70 to 80%. But again, the experience with this virus is only a year. So we don't know. We know what herd immunity is with other diseases. And so the estimations of 70, 80% may be too conservative.
Well, let's talk about the people who might be reluctant to get the shot. I know that today there was a headline in the paper saying that a survey had shown that, up to half of our community was reluctant to get the vaccine. Now, for full context, that survey was taken, I believe, in November and December, so that was before people had actually started to get the shot and had firsthand experience. Nevertheless, there is some reluctance in our community. How do we, what are you doing to allay the fears of people who might have some concerns? Dr. Bruno, let's start with you.
Sure. One of the things our hospitalists did when they got vaccinated is they all made a little sign about why they got vaccinated and put it in social media. And most of the reasons they put that they wanted to get vaccinated was to protect their families, to protect themselves, to protect the community. And so I appeal to the public is we all have fears. The vaccine appears to be safe, and it's not only helping yourself, but it's really helping your community and your family. That's the biggest reason I would put out on why people should get vaccinated.
Sam, what kind of concerns do you hear from people who might have some reluctance with getting a shot?
Yeah, it varies a lot, and it's unfortunate how difficult it is to find reliable data, reliable information. And it's really unfortunate, just to put it bluntly, that this issue has been politicized so much. The questions vary from how fast the vaccine was developed to it's a new vaccine and we don't know anything about it, to concerns that steps of the process were skipped. Again, when you look at the reliable data, when you look at what was put out and the due diligence that Pfizer went through, that Moderna went through, that these other companies are going through now, this is a safe vaccine. When I talk to my infectious disease providers, when we talk to our virologists and the various folks who really look into the science of this vaccine, like Dr. Bruno talked about, it's incredible. I think the most important thing that we can do to help with that is to talk about it and to talk about our experiences. So I know that the four of us on this call have been vaccinated, and my experience was outstanding. I have received both doses, and the feeling of hope and relief that came from those doses has been just incredible. I have a young family. I have a wife who is 38 weeks pregnant, and to know that now they're a little bit more protected because I got the vaccine brings an immense amount of comfort and peace. So I want everybody to experience that.
Well, I'd love to hear each of your experiences. Ryan, let's hear from you as well. What's been your experience with getting the vaccine?
Yeah, similar to Sam. I mean, honestly, it was uneventful, really. A little bit of a sore arm, and that was about it, and was able to go on with normal life. And it's great to be able to have that hope and to know that I'm in a position to keep my family safe, our coworkers safe, and our organization safe. One of the other stories that I would just want to highlight about for those that are reluctant getting the vaccine, on one of the first couple of nights that we opened our vaccine clinic, I myself had a little bit of hesitancy about getting it, similar to some of the issues that Sam has brought up. But almost every one of our medical staff were there getting vaccinated. And they're the people that really understand it, right? They know the ins and outs of what goes in, what's mRNA. And for somebody like myself that doesn't have a clinical background, I don't understand what those things are. But to see the medical staff talk so highly about it, and to be the ones that were there at the front of the line wanting to get it, to me, that was a very powerful statement, to know that if our physicians that are the experts in this field that know the ins and outs of it, and they're the ones that want to get it, to me, that made me feel much safer to be able to get it. And I can tell you that many others within our organization had their minds changed after seeing the tremendous amount of physicians that wanted to get this vaccine and were the ones that were supporting it and saying that it was safe.
Martha, what was your experience in getting the vaccine?
I too had no side effects. I didn't even feel it going in either time. But I thought it was also important as a leader in the hospital, and certainly being out and about quite a bit, and visiting with patients and families, and working with our doctors. It was important that I get vaccinated to protect myself, to protect the people around me. I'd also like to say that there is a lot of reluctance, not just from the community, but even from our staff. And many of them just wanted to see what happened to the people that got it first before they would come forward. And so we're seeing more adoption and less reluctance to go ahead and get the vaccine. Also, what we've tried to do is have frequently asked questions and answers, and we modify them as different types of questions come in. We've got them available on our website so people can see that, and because a lot of people have the same type of questions about the vaccine. And then I think lastly, we've worked with informal leaders. Sometimes they can have the most influence, and certainly with the diverse population that we have, some of those informal leaders or leaders of those groups can really make a difference and help those groups understand why it is so important to get the vaccine. And that has made a difference as well. They've gone ahead and gotten it, and they've told people it's okay and it's safe. And that has made a difference in people wanting to go ahead and take the vaccine.
Dr. Bruno, I'm curious, just because, so many of us are able to stay home, but obviously as an emergency room physician, you have to interact with patients. So how has getting the vaccine, I'm interested to hear your firsthand experience, but also how has it impacted your day-to-day life now working with patients?
That's a great question. So I actually got a little bit of flu-like illness after the second dose, about 12 to 14 hours afterwards. And my friends and colleagues said that's just because my immune system works really well. But who knows what it meant, but it wasn't something I couldn't work. So you may feel a little flu-like illness specifically after the second shot. But your question about how has it changed what we're doing in the emergency department and the rest of the hospital and the other hospitals, staff safety, patient safety is the most important thing. We're still using full PPE protocols. We're making sure all patients are tested as they get admitted. But what I've noticed working clinically is, as I think it was Sam said, there's hope. There's a little bit lighter atmosphere than I would say, 3 to 6 months ago, when there were a lot more COVID patients in the hospital, but also there wasn't vaccine. So I had a similar experience where the physicians, the caregivers who are on the front lines were, as soon as possible, let me get vaccinated. So I think the folks who are taking care of these patients have seen the tragedies that the virus brings, want to get vaccinated, and I appeal to the community for the same.
I want to stay with you for this question. Oh, sorry.
Oh, I was just going to say, to tag on to that, Dr. Bruno mentioned earlier that everything we know about COVID, we've learned in the last 9 months. And, I can tell you, we've seen the treatment, and I'm not a clinician, but I've seen the treatment of this really change. I think our doctors have learned a lot, and they've changed the way they're treating COVID, and it has made a huge difference in the patient's course as well as in their recovery. And it's been really fascinating to see that happen during the course of the past year.
Dr. Bruno, Michael on Maui is saying, if you survived COVID, do you still get to take the vaccine? What is your thoughts on people who have survived COVID now getting the vaccine?
The recommendation is that you still get vaccinated, and we believe that if you get COVID, that like most viruses, you're probably immune. But again, the theme of the night is we're still learning about this disease, and we have a vaccine that's highly effective. So the recommendation is, even if you've had COVID, that you still should be vaccinated.
Sam, you talk about the lack of information and credible information on this. Henrietta via Twitter says, I heard a couple of people died after taking the vaccine. Is that true?
I would defer to Dr. Bruno, who's going to know a lot better than me, but I am not aware of any of circumstance like that. I will say we document, right? So we've done almost 20,000 vaccines, and we document every single reaction that occurs. And none of them have been severe. We've had a few people who have had reactions that need some immediate attention and just help from medical professionals there, but nothing has ever been severe from our experience. I don't know, Dr. Bruno, if you've heard otherwise.
Yeah, I think people are looking nationally to see, now that we're into several weeks to months, the vaccine, is the side effect profile higher in this vaccine than other vaccines? And the general feedback we're getting is that this vaccine is safe within an acceptable range for vaccines. Everybody is keeping patients 15 minutes or so after they're vaccinated, because most of the anaphylaxis or allergic reactions that any vaccine can cause were seen within 15 minutes or so. And so we're all being very careful. I have not heard of extreme reactions here in Hawaii, and nationally, again, it's within an acceptable range for vaccines.
Right, we're getting some questions about just the sort of nuts and bolts of what it takes to sign up. So I wondered if you'd walk us through that. What is the process to sign people up? How does that, is that system working, and can it be improved? So can you take us, Ryan, through just the basics of, okay, I want to get vaccinated, I'm over 75, or I am an essential worker, what happens now?
Yeah, I can walk through our process. I think it's similar to the others, but you log on to our website, adventist.healthcastle.org/vaccine. On there's a link that you click on. You have to fill in some information to talk about which group that you're in. There is a validation process that we go through just to ensure that you are in those respective groups that are approved for the vaccine at that point in time. At that point, we will send you a link that sends you to our appointment scheduling system. And then you go in there and you're able to select the time that's available, and you come in and get your vaccine from us. It does sound simple, but we do recognize that for some of our kupuna, it's not always that easy to be able to do. And we do encourage family and friends and others to be able to help them through that process. But overall, it's been relatively seamless. But I think one of the things that was talked about by this group earlier is we're constantly adapting and changing. These were clinics that were built very quickly. So we're learning things in this process to make it more user-friendly to our community, and we'll continue to do so.
Yeah, and for those folks who aren't tech savvy, is there another mechanism that they can schedule an appointment, like a phone only? I know that you don't want to do necessarily walk-in clinics because you don't want crowding or people, especially elderly, waiting outside, potentially gathering and, contracting the very disease that you're trying to eradicate here. But is there other than signing up online, are there other mechanisms that could be put in place so that people who might not have great internet access can actually take part?
Yeah, we are looking at starting a call center, if you'd say, for individuals to be able to call in and be able to do that. For us specifically, it's a staffing limitation. As you might imagine, when you have, at least on the Windward side, it's 130,000 people. Obviously, not everybody's in those approved categories right now, but the phones ring a lot, even right now. So just trying to be able to staff that appropriately to ensure that we're able to respond to people is challenging, and we're looking to staff up for that, but we're not quite at that point right now.
Martha, since you have the pod systems in place, which obviously can take larger groups, are you anticipating doing any kind of a walk-up at any point, or doing something that is not, something that doesn't need a computer to sign up?
Not at this time. Right now, ours is the website as well. We do have people, once they sign up, they will get a call back for an appointment, but we've learned, unfortunately, when we have set up the phone lines, they have just crashed because people are so anxious about this. So we're trying to balance that and come up with a lot easier ways to access the websites, to self-schedule themselves. And again, we tweak this daily. We work with our IT team to tweak this and make sure that we make it as easy as possible. But again, as Ryan mentioned, we encourage family members to help our kupuna because it is difficult for some people that don't have access. We do have a call center, and we do have for appointments and things, and some people have called the call center, and we've tried to help them through that as well. But we prefer that they use the online systems just because there's so many requests. And And we don't want people to get upset with us when the phone, I mean, our own employees, when we opened our appointments for employees, we crashed the system and we did not anticipate that. And so we had to regroup and figure out again how to do it and make sure it was as user-friendly as possible. But it's hard, because there's so much demand and people are so anxious about this.
Yeah, Dr. Bruno, I'm concerned about folks who might not have a primary care provider, people who are not necessarily part of a healthcare system already. How are you reaching those folks? Are we anticipating community clinics then giving out vaccines, or where do you see that going?
Sure. So I think, and I won't speak for all the health systems, but I think we are common the same in that right now, if you go to our website, is you don't have to be a member of a Queen's Health Plan. Anybody in the community can sign up. We are fortunate we've been able to stand up a contact center, which is 691-2222, and we can help people schedule. But I don't think any of the health systems are turning away people who are not members of their health plans. I think right now, the goal was to stand up large centers, hit the healthcare workers, the kapuna, and then eventually have more outreach into the communities. As you probably know, the skilled nursing facilities, there are people going into the skilled nursing facilities to vaccinate now. And so I think that's one of the first attempts to reach out to the community. And then collectively, how do we all reach out into the communities to reach those who can't come in to get vaccinated?
I want to stay with you this next question. We have a caller from Kahului writing in asking, if the vaccine is effective, why do we still have to wear our masks and socially distance? Once you've gotten that second shot, what are best practices at that point?
Sure, that's an outstanding common question right now. Is we know in other viruses that even if you're immune or been vaccinated for the virus, you can still be a carrier. There's data in the flu virus that you can carry the virus in your nose and then therefore transmit it to other people. And not knowing what the vaccine gives us protection for how long is we're recommending exactly what you hear on TV. Everybody's recommending wear a mask, socially distance, stay out of large groups, specifically indoor large groups. So the same thing that we've been speaking about for the last year. We plead that please continue to do that. The cases are still above 100. There's still patients in the hospitals. So all the good things that people in Hawaii have been doing to continue.
Sam, let's ask this one for you. Linda from Pearl City wants to know, do we need to take the vaccine every year? And from Hawaii, and I guess this would be for each of you, how many people have had a severe reaction and from which vaccine? I think, there's some people wanting to know, should I ask for the Moderna? Should I ask for the Pfizer? Presumably you don't have a choice in terms of which one you get, but are there risks associated one versus another? And do you anticipate having to get, a vaccine every year like we do a flu shot?
Yeah, no, it's another great question, and unfortunately, the answer is still we don't know. These companies started testing these vaccines, less than a year ago, and so we don't simply have enough observation time to understand how long it's going to last and how long these antibodies will be there. So at this point in time, all of that would be a guess, and so we're going to learn more as time goes forward, and that'll teach us a lot more about how long it lasts. We have a little bit of information about how quickly the virus mutates, but even that, it's not enough to know how frequently. And I don't have information on specific to Hawaii, how many reactions there have been. I don't know if somebody else may have that information.
Martha, what's been the experience of your organization when it comes to the reactions?
We've had a few reactions. None of them have been serious, requiring hospitalization. A couple have had to require emergency department visits, but they were then discharged home. So there have been a few, and then they're like allergic type reactions, some respiratory difficulty, hives, but we have not had any life-threatening reactions at any of our sites.
And I think, sorry, real quick, I think it's important to make sure that folks hear as well, right? In the experience that Hawaii Pacific Health has had and that Kaiser has had in Queens, you're hearing that a few people are having reactions. This is out of thousands and thousands of vaccinations given. So, it is a showing to be a very, very safe vaccine. Because again, it's the vast majority have experiences like the four of us have described, that very minimal side effects, if any.
Ryan, can you answer this question from Maui? Why aren't kids under the age of 18 getting vaccinated? I know that we're prioritizing the elderly, but are we anticipating at some point giving the vaccinations to minors?
Yeah, I'll probably have to kick that one over to Dr. Bruno, but I know that from my understanding, they were not included in the clinical trials, I believe, and I think that's part of the reason the recommendation is not there. But that's just from my own reading and research, but would defer to Rick on maybe some of the specifics.
Yeah, I think it's we tried to get the vaccine to the public so fast that children were not included in the original studies, and that may change the indication. We're fortunate that children tend to be less affected as far as severity of illness, but that's the reason it's at this point pediatric patients are not included.
You know, we spent the bulk of the time talking about vaccines, but I want to shift gears a little bit and talk about how your organizations are doing. We see these hospitals on the mainland in California, administrators and doctors there having to make some really tough choices in terms of prioritizing care. How do we make sure that we don't get into that situation here in Hawaii? And Martha, what are the contingencies that you've put in place to try to keep that at bay?
When the COVID-19 whole thing hit Hawaii and started, we not only worked at Hawaii Pacific Health, but amongst all the healthcare systems to make sure that we had specific, what we call surge plans for disaster. We do a lot of disaster planning for the state of Hawaii. And so this was a different type of disaster, but that is the plan that we use. So we have a systematic way that we say we will be able to accommodate patients. You know, different rooms were accommodated or adapted to be able to manage COVID patients. Areas maybe in some of the hospitals that have not been utilized were stood up so that if we could get the staff to fill those, to cover the patients, if they filled those beds, that would happen. We've been very fortunate, I think, when we had the big surge originally earlier this summer in fall, that we all got stretched. I think it was easy to say that we all were thinking, oh boy, if this gets any much worse, we're going to have a problem. But we all talked together as hospitals. We would report our bed numbers every day, our census every day, and if people needed equipment, who we could loan equipment to. And then since then, we haven't seen the surge like they have on the mainland. So we've been very fortunate, but we do have plans for that. And they're at every step of the way where we know we're a hospital maybe at a tipping point where they cannot take any more patients. So we're very comfortable with the plans that we put together for that. We're fortunate right now in that the hospitals, we're busy, but I can tell you the HPH facilities are busy. This is a normally busy time of year for hospitals, January, February, winter, as we call it. This is a busy time of year, and our hospital's been much busier with other patients as opposed to COVID patients, and we feel very fortunate for that. But we are well equipped to manage COVID patients. If there's another big surge, I believe we're well equipped to handle that in our hospitals, and we work together as a team to make sure the equipment, the staff, the supplies, everything they need are going to be available for them.
You know, Dr. Bruno, I think that a lot of people with the vaccine here now do feel like they can kind of breathe a sigh of relief, even if they don't have the shot themselves, feeling like, you know, we saw when the pandemic was first starting, we saw those yellow, I don't know what they're called, like those tents outside of the Queens Medical Center, and feeling like that could be someplace where you were going to see COVID patients overloading like we did in Central Park in New York. We never got there, but could Hawaii still get there?
I think based on past experience is we could get there if we stop doing all the good things that people are doing, wearing masks, socially distancing. I think we've shown that if we're not careful, if we open up too quickly, that we will get a surge until we herd immunity. What we went through this summer, we could go through again. And as Martha said, there were a couple of days that I believe that the hospital, state government were starting to sweat it a little bit, and we were all working very closely together. We were moving patients between facilities to ensure that we had capacity. Most of us had shut off elective cases, closed some of our ambulatory clinics. And so it's very possible it could happen again if we collectively in Hawaii don't do what we should be doing, wearing masks, socially distancing, getting through this. I like to tell my daughter is we're in the 7th inning right now. We still got a couple more innings before we're done. And so, I think there's hope, but we still, the cases on the mainland are still over 150,000 cases a day.
Ryan, one of the things that obviously is keeping the pandemic at bay is PPE, but we learned that at some points it was in very short supply and it's quite expensive. How are our PPE stores doing? Do we have what we need as a state?
Yeah, I believe that we do. I know that there's a state stockpile that's in place through the Healthcare Association that has been beneficial to all of our organizations earlier on in the pandemic, that if we were running short on things, we were able to leverage some of the supplies there. I think as we've been talking about the collaboration amongst our organizations as well, if for some reason one organization is short, we can get in contact with another organization and there's a willingness to be able to share. I mean, we're all in this together and want to make sure that we're successful. And I know for us here at Castle, we've had to stock up on the supplies that we have. Some of the areas that were previously used for different purposes are now supply rooms to ensure that if there is another supply chain disruption, that we are in a position to be able to effectively respond to that with supply shortages that could occur, because it happens at any moment. A factory at some place has a COVID outbreak and they have to shut down, or if they have to start diverting supplies to other hotspots in the mainland, we've got to make sure that we have enough here on island, and I think we're well positioned for that should we experience another surge.
We got a question from Jay on Facebook. Sam, we'll toss this to you. Is this vaccine effective against the new strains of COVID? We've been hearing about these new strains from other parts of the world, and some are here in the United States, if not in Hawaii. So is the vaccine effective?
Yeah, early data, answering the question directly, early data is showing that it is effective. What I would answer it in a little bit different way, though, that the vaccines are ultimately effective against new strains because the more of us that get the vaccine, the less the virus is going to mutate, right? The nature of a virus is that every time it replicates, it has the risk and potential to mutate in some way. And so the only way truly to really overcome this and beat the virus and stop these different strains and mutations from coming is by getting the vaccine and stopping the spread. So, I mean, two answers to it, yes and yes.
Go ahead. Oh, Dr. Bruno, Bria on Facebook says, will Hawaii achieve natural herd immunity due to the population already being infected?
At the rate that we have infections right now, we will not get natural herd immunity for a long time unless the cases go way up. And the problem with that is that we've seen the mortality rate from the virus. So that means people will die. And so the reason to get vaccinated is we don't want natural herd immunity. We want to vaccinate to prevent people from getting the disease.
Martha, Clint asks a question over email. He says, I'm not 75 and I'm not an essential worker. How do I go on the waiting list? I think there are a lot of people who want to know, how will I know when it is my turn?
Well, the Department of Health has a plan, and it goes all the way down through getting down to the 16-year-olds at the right time, or the 18-year-olds. But there is a plan for when we will vaccinate our population. And so we're working very closely with them. For example, first we started with the 75 plus with the kapuna. The next group is the essential workers. We're starting to vaccinate teachers now. And what happens is the Department of Health sends us lists, and then we start reaching out to those individuals through email and other means to say, it's go ahead and, get online, and it's time for you to go ahead and schedule your vaccine. So we will get to those other groups, but we are working very, very closely with the Department of Health. They send us names by zip code. They distribute them to all of our facilities, and then we make sure that we reach out and get those people appointments so they can get the vaccine. So it's going to be a while, but everyone will have their turn.
When do you think that will happen? What at the rate that we're going, when do you think that everyone who wants a shot will actually get one?
I think by the fall or towards the end of the year, based on the way the Department of Health has mapped out the distribution, and as long as we continue to get the vaccine, the group can correct me if I'm wrong, but I'm thinking everyone was planning by the end of the year that we would probably have most of it covered if we get the vaccine. Now, as Sam mentioned earlier, some of these other newer ones coming out are a one-time shot. So there might be real opportunities, again, to work with the pharmacies, the CVS's and the Walgreens out there to also have them available. And then we could have a much faster and wider distribution, but it is going to depend on the vaccine availability.
Our time is running out, but I want to make sure that I get to each of you. This has been such a tough time for so many of us, and I know it has been, especially you guys are on the front lines. I would love to hear from each of you what good that you have seen during this time, a story of hope, if you will. Sam, let's start with you. What lifts your spirits and what gets you through this time?
This last year has been certainly the hardest that I've experienced. There have been immense tragedies. I think every one of us at this point has been impacted by COVID-19 in one way or another. Loved ones, family members, friends. But even amid that, there has been a lot of good that has come from it. When I go into the hospital, as an example, we have asked our physicians and our nurses and our environmental service technicians and the staff that are in the hospital to be extraordinarily flexible. And what's been awesome is you see these people who they have chosen the healthcare industry for a reason, right? They want to help people and they want to do good. And to see them come together and problem solve and put themselves into situations where they are helping vulnerable people has been so uplifting. It shows you what the power of our society is and what the power of our community is when we come together. I've seen that happen at the employee level. I've seen that happen at the community level. I've seen that happen at the organizational level, right? Again, we've said this a few times, but our various hospitals, we're not competing right now. We're partnering. We're partnering in a way that we have never done before. And it's incredibly uplifting. And I hope it sets a new precedent for the future.
Ryan, we have just 3 minutes and I want to get to each of you. So if you could tell us the same, what's giving you hope right now?
Yeah, I gotta agree with what Sam has said. The staff and the work that they have done has been amazing. I'm not sure that there's words to really describe the work that they've done. I remember at the very beginning of the pandemic when we had our first COVID patient come in, there wasn't a fear amongst our staff. There was, I want to jump in and I want to take care of this person. Our job is to be able to care for our community. And that's been the situation all throughout this pandemic. And so I think in short, what gives me hope are the people that work on the front lines in our hospitals and the amazing work that they do every day, because they're the reason why all of us are able to stay safe and continue to live our lives in the way that we'd like to.
Martha?
This pandemic has just brought out the best in so many people. And I can say at Hawaii Pacific Health, our team, just like Ryan and Sam shared, has just been amazing. It's forever changed the way we run our business. I believe that. We've learned a lot of really good things from this pandemic, whether it's, holding virtual clinics and really ramping up telemedicine, to working together as hospitals to make sure that we take care of our community. And our community, I'd like to just shout out to them, has been so supportive, whether it's bringing meals to the staff, making donations. I have never seen people be more generous this past year than in a long time. And everybody wants to support the hospital so we can make sure that our community stays safe and Hawaii as a whole stays safe.
And Dr. Bruno will give you the last word.
I think everybody covered it. The staff at all the hospitals have done an amazing job, from the respiratory therapists to the nurses to the aides. Amazing how people are looking out for each other, reminding each other, wear the right PPE, do the right thing. Also a thank to EMS, police, fire, done an amazing job. And then, as Martha said, the public has just been really supportive of all the hospitals and efforts. Initially, it was outpouring of food and whatnot, but just general support that I think we feel in the community.
Well, thank you so much for all of what each of you do. Thank you for joining us tonight. We want to thank, of course, our guest, Dr. Rick Bruno from the Queens Medical Center, Martha Smith from Hawaii Pacific Health, Kaiser Permanente's Sam Belukov, and Ryan Ashlock from Adventist Health Castle. Next week on Insights, thousands of Hawaii residents who lost their jobs because of the pandemic are in a dire situation, struggling to afford basic needs like rent. We'll hear what help is available in COVID-19 paying the rent. Please do join us then. I'm Yanji Denise for Insights on PBS Hawaii. Aloha.